Back to our coverage of the coronavirus right now. As we mentioned earlier, there are now more than 1,000 deaths in Connecticut. Tonight, we look at some of the most vulnerable and what's being done to keep them safe. Channel 3 Eyewitness News reporter Matthew Campbell is live right now with some of those answers for us tonight. Matthew.
Yeah, Mark, crossing this sad milestone really puts things in perspective, especially when you look closer at who is dying. If you or a loved one live in a nursing home, or if you are a minority, it appears you are at a greater risk.
Governor Lamont started his news conference with a moment of silence, remembering the 1,036 Connecticut lives lost from the coronavirus.
Take a moment to just say a prayer for their families.
Last night, we got stats from inside nursing homes. 375 deaths at the time represented 38% of all coronavirus deaths. This at a time when we saw precious weeks lost when creating exclusive nursing homes for coronavirus patients. We asked what took so long.
There was some significant change in CDC guidelines in the middle of that week that you described that caused the team to have to change course, recognizing the contagious nature of COVID-19 before it becomes symptomatic. It put a significant change in the plan, so there were some adjustments made.
We learned at least one home is up and running.
It has 70 to 80 referrals already in place from hospitals looking to discharge patients, so it's showing the demand and the importance of that, and we're going to be opening up additional alternate sites through the weekend.
More money is coming into these nursing homes to keep workers and residents safe.
Increasing the across-the-board rate increase from 10% to 15% for 3 months here to help cover some of those additional costs they're facing around staffing and PPE.
The other vulnerable population, African Americans. This is their death rate compared to other ethnicities. Governor Lamont admits it's eye-opening.
It's scary as hell. Obviously, some people live in denser areas. Some people can't social distance within their home. Some people have pre-existing conditions, be it asthma or diabetes, and that seems to hit the African American community most severely.
The troubling trend is still being investigated on a global level, so the state is doing what it can with the information it has. So more tests are going to high-risk communities, starting with this rapid testing site at the old Gateway Community College in New Haven.
I'm speaking as an African-American male who was born in Hartford. It's something that is top of mind of the governor and is top of mind of this administration.
Connecticut is one of 4 states partnering with CVS for this. 750 tests will be done daily. They're free. They'll take 30 minutes and do not need a doctor's note.
Answer a few CDC specific questions, and that will be their doctor's note. They don't have to have a PCP.
Now, the CVS testing site starts daily at 10 a.m. You can start getting in line at 9 a.m. The first 100 tests, though, will be dedicated to first responders. And sadly, the governor says 4 tested positive today. That's the latest live above the newsroom. Matthew Campbell, Channel 3 News.